Year by year, as public health is growing leaps and bounds and it is becoming popular, now students are asking a lot of questions regarding for whom it is best option and for whom it is not. Lot of non-science students and especially non-biology students, like students from commerce background, students from arts background, students from humanities background, they're asking, is public health good even for them? I'm Dr. Pranav, HOD Public Health, and a scientist working in this field for more than 2 decades now. Today, I'm going to discuss all your doubts and queries regarding for whom public health is a good career and for whom it is not. So, starting first, the very first statement I would like to make is there is no one, mark my words, there is no one who cannot contribute for public health. Because as we discussed, the approach of public health is entirely different from clinical health. Clinical health depends upon diagnosis, treatment. So it is about hospital setting to diagnose. You need to have a formal training of more than 4 years to become a doctor, and then 1 year intense guided training to get a license to practice in India or abroad. So it takes no less than 5.5 years to become a doctor. But all those people who are interested in preventing the disease in the community, promoting the health in the community, and protecting people against different disease conditions, if this is your passion and you want to contribute, public health is an opportunity where you can come on. And this is a multidisciplinary effort. Today, I'll start my discussion with all the different disciplines who are involved in designing a good public health program. So, suppose I want to understand, as a person involved in government ministry, how to promote health and how to prevent, say, take any disease, say tuberculosis in a particular district. So, the effort will start with a survey, and the survey will be designed by a team of doctors, by a team of health administrators, and a team of biostatisticians who can come from medical background or who can come out even outside of medical background. So these people together, doctors, health administrators, and biostatistician, epidemiologists, they will come together and start a screening program. Now, as after doing MPH, you can become a public health administrator, you can become an epidemiologist, and you can become a biostatistician. And thus, you can start contributing in screening of disease. Now, after doing the screening of disease, finding out how many people are affected in a particular district, you can start your research with finding out what are the causative factors of a particular disease in a district. This is again a multidisciplinary effort. Now, with this, there will be a policy matter. So, health policy matter again will be discussed by people from administrative services in India. There will be IASs who are working in health department, who are also coming from multiple different background. IASs come from all the background. They can be political science graduate, they can be Sanskrit graduate, they can be Hindi literature graduate. But after administrative accomplishment and experience, they will be contributing as leaders of administration. Then from medical side, scientists from research wing will contribute. Public health policy makers and consultants will be involved, who will be the MPH, that is masters of public health people. So they will together formulate a policy which will be weighted by government in consultation with state governments, and then a policy is formulated. Now, to implement the policy, again consultants will be involved, And very interestingly, now people who have got experience of handling finance, mark my words, finance, so they will be coming. They will be maybe MBA finance or maybe financing graduates from different stream, maybe BCom, CA background. So all those different financial background people who have got experience of working in healthcare, they will be coming and helping us in planning a good financial approach to curb, control, and use the money best way. Then the policy will be implemented. Again, now implementation officers at different rank, they will can be coming from nursing background, they can be coming from diagnostic background, they can be coming from lab technology background, they can also be coming from medical background, vector borne diseases background, entomology background, which is biology, geology background. Alongside all those people, public health will also be contributed by people coming from political science, people coming from humanities like anthropology, all those people coming from psychology background who has grasp over communication design. They all will come together and design communication policies, health interventions, and thus a good intervention program will start getting implemented. So it will be having a large team based of different background, as we discussed and enumerated: anthropology, people who understand society, that is coming from sociology background and then have got masters in public health; advertisement background people who will be helping us design good communication strategies. So now you can see we have used expertise from every background, including finance, including advertisement, including mass communication, for designing our campaigns for disease protection, how we can get a very healthy relationship and a unbiased, free flowing conversation about health and sensitive issues like HIV, tuberculosis, anemia in the communities. So, all these background people will come together, and as I keep emphasizing in all my lectures, public health need contribution from everyone. So, you are only limited by your imagination and passion. If you imagine yourself as a public health leader, if you want to contribute to the health journey of India, you are most welcome. And great leaders and great public health scientists can be minted out of people with passion, people with commitment, and people with deep desire to bring change in the community. All the rest thing can be taught. We design curriculum of Masters of Public Health in a way that we give you all the principles and practice of behavioral change communication, which is part of mass communication design. We give you emphasis on screening, how to conduct it, how to design screening tools, which is part of biostatistics. We give you all the aspects of management so that you come up as a leader in public health implementation in managerial roles. Then we teach you how to do research so that you become great in research and data analysis. So, as I told you, if you have got a passion to convert your energies into health leadership positions, public health is the best opportunity. And considering the kind of great strides India is making these days in public health, like the government has been pushing so much about hygiene, safe drinking water access to everyone, Jan Aushadhi Pariyojana to provide quality health medicine to every individual in India, Operation Indradhanush to provide vaccination to all Indian citizens, creating right technological platforms so that we reach out to every individual in every nook and corner of India. We need now millions and millions of public health professionals to take leadership role and implement this great vision of making India healthy. It's not at all possible without the support of people coming from every domain. So If you have a misconception that this is just for doctors, live aside. Doctors are not in enough number to take up this role. You have to come forward, and every domain has to contribute to this journey of public health in India. Without contribution from every domain, this is not possible. So I urge you, all the young people, let's contribute to the journey of public health. Join MPH. If you are coming even from literature, if you are coming from history background, political science, BCom background, apart from all health and allied sciences like nursing, biotechnology, like medical lab technology, radiology background, all people alongside doctors and BDSs and veterinary doctors, we can come shoulder to shoulder to contribute to this health journey and make India healthy. It is our joint responsibility, and we can together only see the dream of making India healthy. Let's join. Thank you. And if you have any question and query, as I keep saying, you can ask your question right here in the comment box. You can also contact us on the WhatsApp number given below. We'll be more than happy to contact with you. If you found this video to be useful, please do share with your friends. Don't forget to press the subscribe button, like button. Thank you all.